All right, and for more on the rising numbers of infections in the country, we are now joined via Zoom by the health activist and Dr. Kgosi Letlape. It's always a pleasure to see you, Dr. Letlape. Thanks very much for being with us here on SABC News this afternoon.
Good afternoon to you and good afternoon to the viewers.
Well, a grim picture being painted there by our report there by Griselda Lewis. I mean, the fact is that hospital beds are filling up yet again, and of course the increased number of admissions. At this time, what has been your biggest concern, as of course we're talking about a third wave and the possibility of it being actually stronger than the waves we've sort of been accustomed to and that we've been through? I mean, what are your thoughts and what can you tell us about this?
My greatest concern is the high degree of non-compliance from us as citizens. When you walk around, you see people in a taxi. Some of them are not wearing masks. You see people walking around in crowded malls without masks. And that is a concern. And also the fact that the president gave us leeway with less tighter restrictions. Given what we're experiencing, I had anticipated much firmer decisions around restrictions. Yeah. And I hope that will come sooner rather than later.
I mean, Dr. Letlape, it's clear that, you know, we as South Africans should also be taking some sort of a responsibility. You know, you raise the issue of non-compliance, but certainly the government at this stage should be meeting us halfway. I mean, we thought that would be quite far when it comes to the vaccination drive and people getting vaccinated. And we keep hearing more and more issues about these vaccines that have been introduced to South Africa. What are your thoughts on the issues of vaccination? I mean, we now understand that some J&J vaccines have had to be dumped and can't be used. All of this is adding surely to some of the stress and the issues that are adding to the fact that our numbers are increasing at this time, in that we can't meet you know, the issue halfway, given that people are not getting vaccinated.
I think one of the problems that we have is that we love magical solutions and magic bullets.
Yeah.
Even if we had the number of vaccines as we had planned, those vaccines would protect those that have the vaccines if they've had the Pfizer dose for more than 3 weeks, or have had their second dose, or they've had a Johnson & Johnson dose for more than 3 weeks. But when you look at where we are, even if we had the vaccines, the way we would protect against a third wave would still be the non-pharmaceutical methods, because the numbers would not be sufficient for us to have herd immunity. They would be too small. You'd still be having 5% or less of the population vaccinated. If you look at the numbers that we have, Pfizer first dose, 1.3 million, just under 1.3 million. Johnson & Johnson, just under 500,000. So you got 1.8 million people that have had a vaccine. 500,000 have finished the course. On a population of 60 million, that is a small percentage that we're talking about. We're talking about 3–4%. That is not going to give you any immunity as a community. Those that have the vaccine will be protected against severe disease, but it's not going to curb the spread of the disease in terms of what is promised. Yeah. So all of us have to understand that for this third wave, the protection that we have is still the non-pharmaceutical methods. It would be a shot in the arm if we had more vaccines in people's arms, but that would still not be the major way of protecting ourselves in this wave.
Yeah. Doctor,
this wave,
yes,
still the basics.
Since from what I understand, you know, you're saying that we can't 100% rely on the vaccine or our own vaccination drive. Let's then look to some possible solutions. We understand that the president is in talks throughout the day today in ways to find out, you know, what more we can do to curb the effects of the third wave. What do you expect to come out of that? I mean, South Africans really sort of, some of them really complaining about going into harder lockdowns, but is that possibly, you know, the only solution then at this time to curb, you know, the spread of the coronavirus and really this third wave that's said to be quite dangerous?
I think I'd have a duty to clarify something first before we go there.
Sure.
That vaccines are important, and anybody that's eligible for vaccination should make themselves available. If you can get a vaccine, please get the vaccine. Yeah. But we must separate the issue of herd immunity and population protection. This will protect you at a personal level because the numbers are not high enough. It is good that it's been offered to frontline health workers. But the main way we're going to contain this third wave is through what we know: masking, gathering, the 3 C's. Don't go into closed environments. Don't go into gatherings. Cover your mouth. Those are the things that we need to do going forward. So I would expect that, given the fact that the numbers are rising, if you go back, Flo, when we had lockdown level 5 in March of last year, we even had very small numbers with no deaths. We now have high numbers. So we now have to make a decision. Is it lives before livelihoods or livelihoods before lives? And these are difficult decisions for the authorities. But far more importantly is that as citizens, at an individual level, we have all the information to make informed decisions about protecting those around us and protecting ourselves. Yeah. I would expect the level to go up. And I hope what they might introduce is what we've spoken about, that when there are fires, contain the fires. There's nothing that should prevent the Command Council from recommending differential lockdowns for the different provinces. Gauteng being the epicenter, we should have maximum lockdown. Yeah. It does not have to be uniform with areas that are having low numbers. So once we do that, we can do lockdowns quickly, early, to derive the maximum benefit.
Well, some reports are saying that the demand for hospital beds in Gauteng amid this third wave are indeed at crisis levels. Doctor, would you agree with that? Would you agree with the fact that we are at a stage where it is a crisis, and can we now panic, given the fact that, even in our previous report that you saw just before we spoke to you, the fact is that the hospital beds are filling up. But are we at a stage where one can see this as a crisis at this time?
Well, the hospital beds are filling up. The crisis is ahead of us. Remember that there's a 2-week lag in terms of what you see. So what we see now are probably people that were infected 2 weeks ago. The people that have been infected in the last 2 weeks are still going to come into the system. Yeah. The numbers are rising of the people that are going into the hospitals, and we must anticipate difficult times lie ahead. How do we protect? We've always spoken before about stay home so that you can stay out of the hospital. It's time to repeat those messages. We should not wait until there are no beds, there's insufficient oxygen for us to do the right thing. We need to do the right thing in good time so that we can get the maximum benefit of those non-pharmaceutical methods.
All right, Dr. Letlape, always great to chat to you. Thank you for giving us that information. We'll certainly be chatting with you at a later stage. Thank you, sir.
Yeah, thank you very much.
All right, that is Dr. Kgosi Letlape, who is a medical practitioner and health activist.